Hey everyone, welcome back. My name is Dr. Shayna Powell. I'm a naturopathic doctor in Montrose, Colorado, and owner of West Oaks Wellness. Today we have a special guest, a colleague and friend of mine, Dr. Danny Dowling. He's visiting from Fort Collins, and I will let him introduce himself. We have an interesting array of conversation that we'll likely have today, but we're going to kind of keep it a little spontaneous and see what we get into. Danny, will you introduce yourself?
Yeah. Hey everybody, I'm a naturopathic doctor in Fort Collins. Shane and I actually went to school together. We started together at Bastyr University. But I've been practicing in Fort Collins for almost 2 years now, and I'm focusing on chronic infections. I see a lot of digestive health issues, mental health, lots of hormonal issues. So we're going to dive into a lot of those things.
Yeah. Where I'd like to start is there's been some things that have surprised me in clinical practice that, especially moving from Seattle to Colorado, there were things my brain was like, that shouldn't be here, but here we are.
Yeah.
What are some things that have surprised you in clinical practice?
I think the biggest issues that I've been seeing kind of generational speaking. So I've been kind of surprised by how Gen Z has been impacted in my practice, seeing how sick they are. Yeah, for lack of better terms. I've been dealing with a lot of mental health issues, substance abuse issues, hormonal issues, things that, 28-year-old females that are seeming like they're in postmenopause.
Right.
And then, having patients that are using substances that none of my adult patients are using. And then
like street drugs or medications, both?
Alcohol, nicotine, vapes.
Yeah, vapes. Oh my gosh.
That was bad in Seattle too, but
it was.
Yeah.
I recently went to a concert, and I haven't been to Fiddler's Green, which is in Denver, in probably 10-ish years.
Yeah.
But this was before cannabis vapes, hash pens, and then also nicotine vapes. And literally everybody is sucking on these things like freaking binkies.
Yeah.
And, Fiddler's Green is an outside amphitheater, but even smoking cigarettes was never the way that the vaping has become for people. All the weird smells, you're going to tell me that stuff is good for you?
Yeah.
And the whole thing is right, cigarettes are bad for you. We know that. Most Americans don't smoke the way Europeans smoke. We can get into how cigarettes are made and all that stuff. But here's the problem I have with vapes specifically. It's pure nicotine. So if that cartridge breaks and you get it on your kid or your dog, nicotine poisoning. What about all the additives, the flavors? You really need a cotton candy flavored whatever, and that's for your 45-year-old person who's trying to get off smoking cigs? No. That is definitely targeted at young people.
Yeah, I think accessibility and then dose is an interesting thing. So patients that come in and they don't realize that they're taking such a large dose in a short period of time, and so they have symptoms of anxiety or gastric symptoms, diarrhea. Yeah, and then you have to kind of parse that out in clinical practice. Is there some kind of infection going on?
Right.
That's why it's so important for us to spend a lot of time with patients, ask tons of questions. So, as you know, I spend 90 minutes with new patients.
Same.
And that is the difference between us and a conventional medical model. And it's the model that's the problem, not necessarily
the insurance model specifically.
Not necessarily the doctors.
Yeah.
It's not necessarily the doctor's fault. It's the structure that they're sitting in.
Yeah, exactly. Yeah. There's a couple MDs here in town that do direct primary care, and I know you've got some medical folk up in Fort Collins that do something similar, and they get to spend, this is how doctors used to be. It didn't used to be this okay, you have 7 to 12 minutes that you get to spend and you need to find out all these things. And the problem, I learned this last year doing legislative work, CMS, the Centers for Medicare and Medicaid Society, social, whatever it is, CMS. They control how you do things, especially insurance-wise, because they fund so many of the residencies. And there's 2,500 metrics that you are required to get in every freaking visit. That's why they have to ask you, remember when we did all that epic charting and we have to ask these redundant questions that we asked them and we saw this patient last week? That's CMS giving us we need this list of check marks.
Yeah.
And who cares? The person that's sitting in front of us, we would never get to parse through, is this person overdosing on vaping, nicotine, and they're having a bunch of side effects from this their substance that they're using. Well, if you spend 10 minutes collecting all those checkpoints, you have 2 to 2 to 5 minutes left
Yeah.
to figure out why they have chronic diarrhea.
Yeah.
That's a lot of time.
The thing that I have to kind of explain to as I'm networking and building my practice, the thing that I explain over and over is kind of the financial piece of this. Because in Colorado, we are not covered by insurance, so my practice is cash-based,
Yeah.
meaning that allows me to spend more time with patients. But it also is the dilemma for the patient because they're paying for health insurance and they also have to potentially come to me. So
Yeah.
a lot of times I see people that have gone to 5 or 6 different specialists, potentially on medications that are hard to get off because they've seen those specialists and they haven't been able to actually like dive into the underlying issue. So I mean, we could talk about that for forever, but
Yeah.
so the thing that I try to explain is that you're spending a little bit extra money up front, but you're saving a lot of time and stress and money in the long run, because a lot of times people still go to the medical doctor and come away with a bill. You go get a mole removed and you have like an $800 bill after insurance coverage. So it's still, that's less than most of my new patients spend on a visit, including labs and things.
Yeah.
So.
Yeah. I just had a patient. We tried to use his insurance to cover labs, which we can do in Colorado.
Yeah.
Not all insurances will do that. And for like 6 tests, it was like $500 cash pay insurance price.
Yeah.
My total, including my venipuncture fee, $146. So we give our patients like a little bit of a benefit, but it was good for my patient to see that because they were like, wow, like the services that you're providing, and like I pay monthly for my insurance, and that's a trouble thing, isn't it? I don't have insurance personally for a number of reasons, but part of it was because of the whole, like, I saw the bunch of specialists, I was on a bunch of medications, some of which were very difficult to come off of, and that hardship and that struggle that year of coming off those pills, I would not wish that on my worst enemy because it was so horrific. I am expecting, and we got an ultrasound done. It was the same price as my friend who pays $400 a month for her insurance, and they had to pay the same price that I paid without having to pay $400 a month.
Yeah, and you have the advantage of knowing what you need too.
Right.
So that's
exactly compared to our general public.
Yeah, whereas like that's why it's so helpful to have someone, because more and more doctors are highly specialized. It's the only way to really market yourself and to make money as a physician, and to be a tool for a hospital or a clinic. So we're running out of family medicine doctors that can actually take different pieces of information and put them together and think about the body as a whole and how things are interrelated and connected.
Yeah, and the 2 least paid professions in the medical system, family medicine and psychiatrists.
Yeah.
And there's even some like, oh, you didn't get into your cardiothoracic surgeon rotation because you didn't do well enough on blah, blah, blah test. So there's definitely some like better than hoity-toity attitudes towards practitioners that choose to go into family medicine, which is arguably very difficult. You have to know a lot about a lot of different things in order to be able to connect the dots. And this is what I love about our medicine is like we learn systems, like systems thinking. Like, okay, you don't just see a neurologist for your migraines. Maybe your migraines are hormonal. Oh, turns out your period and you're having bad periods. And like, that's when your migraines get the worst, is right before you start your cycle. Like, I wonder if that has anything to do with your digestive function or... I just had a discovery call this morning, and guess what? This lady has fatigue, and she's talking about all these like big things, all these diagnoses, and I was like, where I would start is with your gut. And she's like, oh, let me tell you about my gut. And it's like, you don't even have to like, it's like predictable at this point,
Yeah, and I think the big thing that allows us to do all that is we have extra tools. We're trained in pharmacology, so we know how those work, but we can stray away from those things as well and be more creative, and also allows us to talk about, trauma and the nervous system and, their history, actually hear someone's story, and that in itself is huge and healing, and a lot of people
therapeutic.
would never think to get that from their doctor.
No, and we were talking too before, like I've had a number of patients that, by the time we're 45 minutes into the visit, right before we do physical exam, they're coming to see me. One guy stands out, his PCP wanted to send him to a urologist. He's young. He shouldn't be needing to go see a urologist, but he was getting up and peeing a lot at night.
Yeah.
You know why? Because he was drinking all of his water right before bed.
Yeah. Those
It's
things
like
get missed.
they get missed, and so we over-pathologize when he didn't actually need to go see a specialist and wait a few months and like take time off of work and all these things. He just needed someone to like sit down, have that longer conversation, and yeah, we're going to talk about your water and, you know, your nutrition, although I talk less about that on the first visit because of disordered eating. But like, we have to be able to understand these basic foundations for health before we jump the gun to our conventional counterparts' primary tools of pills and procedures. While I appreciate those, they are very high force intervention on the therapeutic order. There's a place, but that's why they should come. People should see us first as primary care.
Definitely. Yeah, and I was telling you before this that, you know, I had that patient that thought she might have a brain tumor. She was having really severe headaches. No, she had seen a specialist, and they were just ruling out a potential brain tumor. They were sending her for a functional MRI, and they didn't think to ask if she had quit anything recently or changed her diet, or and she happened to have cut out caffeine completely. And so I said, wait it out for a couple weeks before you go and scare yourself. I mean, it's not going to hurt anything to get some imaging.
No.
But yeah, I think
I'm sure nothing will show up.
I hear those little stories all the time where, you know, that's where it's ironic that our first principle in medicine and healthcare is first do no harm.
Right, but we're not asking these basic questions like, well, when are you drinking your water? Well, I forget all day and I drink it right before bed. You know, I drink my 4 cups right before I go to bed. I'm like, well, there you go. That's why you're peeing multiple times at night. You need to drink water throughout the day, or you quit caffeine, and depending on how much caffeine she was consuming, like caffeine can be a brutal drug to come off of. For a lot of people, it can cause you to be like recoil in your bedroom for like days.
Right. Yeah, and I have a few cases where, you know, people are, even with pharmaceuticals, maybe there are some interactions between the ones they're taking that were given by different providers. Or
who don't do drug interaction checkers. It's something I do with all of my patients that are on multiple medications.
Right, and like we could get into the field of psychiatry, but that is that's the field that really rubs me the wrong way. And it's not their fault necessarily. They have a limited amount of tools, but at the same time, there are so many things that should be addressed before putting someone on a medication that is going to make them tired but not able to sleep, you know, and then SSRIs, that, you know, it's standard of care to be on that for 12 months before you make a decision to stay on it or not.
Right.
So it's like, okay, well, what about blood sugar regulation? What about sleep? What about relationships? What about lowering inflammation in the body? What about the microbiome? Has this person had an infection? Have they been on an antibiotic protocol? Like what's been thrown off? When did this start? Has this been going on forever? Is there like an immediate, you know, point where it started? And even then it might not be clear. So that's why, like,
And here's another one. It's like, if you've had a bunch of circumstances, say you lost your best friend, your grandma, and your aunt, and you were all very close to those people, all in the same, like, 6-week period, do you think it's normal to feel a little bit depressed and down? Fuck yeah, it is. But you're feeling depressed. We can't have emotions. We need to have an antidepressant. Maybe, and there becomes a point at which that grief stage becomes problematic, but if it's just been 6 weeks since, like, your whole life was tossed up with all these beautiful humans that you lost and you don't have them, give yourself some time to grieve. It's normal to feel sad and like you have a storm cloud over your head, like those old Wellbutrin ads that we saw when we were growing up. We've pathologized so much, and I agree with you, the psychiatric field, psychopharmacologists, they rub me the wrong way too, because you can be on Adderall and Xanax and it's totally fine, even those that have an X interaction.
Up and down, they're licensed drug dealers.
Pretty much.
It's a mess.
Here, this was a personal story. My family does not do well with antidepressants, SSRIs specifically. We have a lot of like side effects that we get. We probably have some genetic SNP issues, single nucleotide polymorphisms like MTHFR, although that's not the one that my family has an issue with. My niece goes to the urgent care. She's having a panic attack. Urgent care prescribes her an antidepressant that both her mom and I have had negative effects with. Guess what happened? She had a negative effect with it. No one was following up with her, though, because she didn't see a primary care provider. And she went to urgent care, and they were like, this is going to help with your panic attacks.
What was the effect?
Sort of trending towards serotonin syndrome.
Okay.
Like highly reactive, like
Yeah.
really freaking out and
Yeah.
like wigged out, like making panic attacks worse.
Interesting.
Fantastic.
Yeah. Yeah, and I've had patients that I've had to help get off benzodiazepines, and
Yeah.
those are extremely difficult to get off of.
Yeah.
And a lot of people, this patient, was vaping a lot and had hormonal imbalances and other things that have been going on, night
Yeah.
terrors, sleep issues, all kinds of things that needed to be
History of
talked about.
trauma.
And, yes.
Yeah.
Yeah.
See, we just numb it with the benzos. So let's talk about hormonal issues, because we see this all the time. Like, oh, I have hormonal issues. Or one of my discovery calls was like, yeah, I've got the telltale signs of high cortisol, but it's never been tested. It's like, as much as social media is helpful, I also find it to be hugely detrimental, because I want to know what your symptoms are, not what social media is telling you your symptoms are, and then we need to run objective measures.
Mm-hmm.
So when you say hormonal changes, what are you saying? What are you meaning?
In terms of imbalances?
Yeah.
I'm meaning like dysregulation in your cycle, heavy bleeding, not having a cycle, heavy cramping in general. If it's excessive or it's debilitating, then that's an issue. Acne, I see a lot of PCOS, polycystic ovarian syndrome. The excessive pain and bleeding issues, pain with sex, all those things.
So what about like thyroid? So hormones, I think about like, insulin, blood sugar. I think about thyroid.
Yeah, that's just sex hormones.
Sex
that I was
hormones,
talking about.
exactly. Yeah. And so like I like to really be specific when I'm having these conversations, in that I want people to understand that like if you're having a thyroid issue, whether it's low or high thyroid, it presents a little bit differently. But and what we learned in our like endocrinology classes is like if one hormone is like going to be out of whack, especially if we're talking about the sex hormones from the cholesterol pathway, it's going to affect all of those hormones, because the body's going to preferentially prefer one pathway, whether it's PCOS and having higher androgens, things like testosterone, or whether you have
insulin.
Exactly. There's usually an insulin component. So like I want people to understand that we're looking at this from a multifaceted approach. We're never just going to be like, oh, you have anxiety and panic attacks and heavy menstrual periods. Like, here's your IUD and here's your antidepressant on your way.
Yeah. And specifically with the younger generations, like I was mentioning, the amount of stress that's going on, just existential, but also, social isolation, depression, anxiety. A lot of those things playing into stress, and that stress contributing to their cortisol pool, and that spiking their blood sugar, and that stealing from their sex hormones. So that's why they're not having a period, and that might be why they have, blood sugar dysregulation, or, all those things. Absolutely. And then you get into environmental medicine, like even just all the estrogens that we're exposed to in our environment, and that alone, if you're just looking into estrogen dominance, is a thing that I see so much, even in combination with PCOS, which makes that worse. Right. So,
do you test for estrogen dominance?
The thing that yes, I do. Yeah. I might use like a Dutch test. That's typically kind of the more functional testing I would do. It's expensive, but it is for reproductive females. That is probably the most effective test. It gives me the most information, tells me how they're breaking down their estrogens, how they're making them, progesterone levels, DHEA, cortisol, and and then there's food and specific nutrients that we can work on. I'm not trying to throw supplements at people, but sometimes getting the momentum going with having someone feel better. That's how I think about supplements. They kind of just help someone, jumpstart, get them back on the train tracks. And then food and lifestyle, it's different for everybody, especially culturally speaking, socioeconomic conditions. So kind of just trying to figure out the simplest way to improve diet long term, and it's something that it takes a lot of time to change.
It does.
And some people are quicker than others. But if you notice those benefits sooner rather than later, people, I see them, work harder and try
the
to
habit change is like quicker.
Yeah, they see the benefits, and so that encourages them to keep working, and that's really like those are those are the people that get the best results from naturopathic medicine.
Yeah. People that are a little bit more motivated they're like, wow, I do feel a lot better. Like they're listening to their body. They're not just listening to social media or like, I have a problem in my head because I have depression and my doctor said I have depression for the rest of my life. That is really one thing that really grinds my gears about conventional medicine is this is going to be a problem for you forever.
I was waiting for the grind my gears.
Forever.
Yeah.
It's just like problematic, but I like that you use the Dutch. I do find it to be valuable. I'm a little more like, choosy with it. But the problem with like blood testing is it gives you like a point. It doesn't give you metabolites, which is like the total breakdown. The Dutch is pretty comprehensive, but so it has a place.
Yeah.
That's great. I love that we're doing testing so we're not just like, because one of the things I've learned is like I'll get myself in trouble.
Yeah.
I'll see a clinical presentation, do a good physical exam, take history, and this patient is sitting in front of me and I'm like, oh yeah, you definitely have unopposed estrogen. We're going to do these things. They don't improve.
Yeah.
We run a test and actually that's not the problem that they're having. They're having something slightly different.
Yeah.
And so we can make those assumptions, but there's a little bit of like, well, that cost was time. Instead of financial, it was time.
Yeah.
So we have to consider the various costs involved.
Definitely.
Right.
Yeah, and depending on the degree of like how much someone is suffering and the kind of the complexity of symptoms, if something is not exactly clear or it's pretty severe, that's when I would be like, okay, this is going to be. I was mentioning this to you yesterday when I explain like what would be the next best step in terms of lab work. It's like, okay, here are the thorough. If I was going to be as thorough as possible, these are the things I would check.
Yep.
And then if these are kind of the nuts and bolts things that we need to know.
For sure.
So that kind of helps, for people that, just want to figure out the nuts and bolts, or other people are like, I've been dealing with this for a long time. Yeah. And I've seen a lot of different doctors and I want to know the freaking answer and figure it out. So, sometimes people are more thorough and, I've learned a lot about more functional testing, and since I've started practicing, I think that's probably the one area that we didn't get a ton of experience in medical school with. Yeah. More of the conventional testing is useful, but so like organic acid tests is one that I've been using a ton, and I think is extremely useful, especially for those complex chronic health conditions where people have been, maybe there's a chronic infection, or maybe there's a nutrient deficiency, or you think there might be some kind of environmental exposure. I use it in combination for people that I suspect there's been black mold exposure, or just weird digestive symptoms.
Yeah, organic acids is a urine test, right?
Yep.
And I've often thought about it from the perspective of like neurotransmitter breakdown. Yep. But also you can check if there's a candida, which is a type of yeast overgrowth, right? Yep. And then specific nutrients. Yes. So it's again that metabolite. So it gives us like a little bit of an insight into what's going on. I really do like the metabolite testing. Yeah. And like you, I didn't get a lot. My training that I got in these types of testing, I got in off-site preceptorships. People that were like, yeah, I'm so glad this test exists, but we didn't want to be, how do I say, conditioned by brand specific supplements or testing or any of this stuff, because we want to make sure that we are being objective in our clinical experience. Yeah. So there's a value there.
That's a good place to start from. Yeah. But it's like, okay, well, what works the best? Right. What gives us the most useful information? And the funny thing is that if you get an organic acids test through like LabCorp or something like that, or a hospital, I had a patient do this because I was, ignorant to what it actually looked like. I thought it would be a little bit more informative, but it literally just said, not detected. And there are literally like 100 metabolites on that test. Yeah. On the one that we run.
Yeah, and they're pretty comprehensive, exactly. Yeah. So you're talking about mental health struggles in Gen Z. Yeah. I'm seeing really young patients, even with parents that are like super tuned in, like they eat a pretty solid whole foods diet, like they've reduced their xenoestrogens, which is estrogens that mimic our normal estrogens. Right. They're pretty tuned in to like what do we need to do to be healthy and to reduce our risk and blah, blah, blah. And these kids, like eczema is just like ubiquitous in little kids. And it's one of my sickest patients I saw was a kiddo that was under 6 years old and just covered head to toe in eczema. And this poor kid was writhing in pain. It didn't matter if they did steroids. It didn't matter if they did antibiotics. This kid was just like messed up.
Yeah.
It's like, that was not really a thing even when we were growing up. And yeah, I had eczema growing up, but it was never like that. It was uncomfortable, but it wasn't to the point where like my skin looked like I was on fire.
Yeah. Well,
head to toe.
What were you suspecting with that person?
You know, what I think it is like our immune systems is highly dysregulated for a number of reasons. I think there's things that are outside of our control, and going to like a generational piece, like mom is in our age. So then we have to think about her parents, and were they in a military environment? And they were. And what about grandparents, where again, the exposures and the effects that then has on our genetics. And I'm not a person that's like, oh, it's genetic, there's nothing we can do about it. We were able to find some good relief for him, but you know, it's a tough case. And really, we ended up doing a lot more supplementation than I typically like, cleaning up the water, removing the carpet from the house, getting rid of pets, which I hate doing, but it made a difference in kiddo's life. And, you know, mom too, getting a job. Mom was a stay-at-home job, you know, part-time, nothing too crazy. Made a big difference because he was feeding off of her anxiety of, my kid's sick, I want to know what's wrong with my kid, why can't anything help? So I really think that supporting the immune system and getting the immune system to stop, you know, while eczema is not an autoimmune, it sort of behaves in it's kind of in that same pathway in my brain of autoimmunity. Yeah,
and like with kiddos, like the most obvious thing to me is like, okay, there are certain foods that are highly allergenic.
We tried it all.
Tried all that. Yeah, and then like histamines are another big issue that I've been running into with a lot of people.
See, immune system dysregulation. Why are histamines going off the charts? It's like, again, not a conversation that we were having 20, 30 years ago in medicine, and now it's everywhere. That's very curious. Why?
Well, and the gut lining, I think there's so many insults on the gut lining. You know, we use this term leaky gut, and it's fun to explain, and it's hard for people to realize like, oh yeah, this is actually, like, this is the root of the issue. You know, so repairing that, cutting things out, I think that's, and then inflammation. You know, when we were in pathology class, literally every pathology ended, remember, Dr. Mung? Every pathology started with inflammation. So it's like, if we're not addressing inflammation, I'm not talking about ibuprofen and Tylenol and steroids.
Again, addressing that immune system component, which most inflammation comes from where? Our own immune system. But here's the problem, is when it becomes like, it's a fire that can't get put out. It's become dysregulated. The body's still freaking out. This is how I explain leaky gut. It's called intestinal permeability in the data. And so I want people to know that, like, while leaky gut in those lay terms are not found in the data, intestinal permeability is. We have a single layer of cells in our gut lining, and it's covered in mucus, and then the tube where we have the microbes, right? Here's what happens. That mucosal layer kind of goes away, maybe because we're not eating the right things, maybe we're being exposed to way too much freaking glyphosate, which we've talked about before on the podcast. And so then it gets degraded, and now we have our cells exposed, and we're supposed to, the way I think of everything in like a dynamic state, like we have a little bit of motion, being able to close. But what happens is like these cells get inflamed and puffy like rug burn. And now they can't close properly. Now we have food particles, we have microbes, and right underneath of that single layer of cell, we have our blood vessels and our nervous system and parts of our immune system. 70% of our immune system is right below that single layer of freaking cells. And while our digestive system regenerates every like 4 to 7 days, it's not every single cell over the 7 days. It's like a gradual replacement.
So how do we help change kiddos' diets? Because that's, and you're about to find out how hard that is, but like, you're gonna start off the right way, right? But so many kids that I see, you know, they crave sugar. They're eating grains nonstop. They're eating white foods, you know, drinking juice. You know, I think the biggest thing that parents could do to address that would just don't have these processed carbs in the house.
Exactly.
You know, focusing more on snacks that are rich in protein. That alone, just keep it that simple.
Yeah.
That's all you. It's a big ask, but those things are huge.
Yeah, have some apples and some peanut butter.
And we're feeding babies rice formula. You know, it's like or rice meal. It's
yeah. Yeah, don't even give me the formula thing. Like 99% of American-made formula has high fructose corn syrup as the main freaking ingredient.
Yeah.
On top of high fructose corn syrup being problematic for development of non-alcoholic fatty liver and metabolic syndrome, a variety of blood sugar dysregulation problems, it also is genetically engineered.
Yeah.
It also is sprayed with glyphosate. So like we're getting a genetic engineered product that our body doesn't recognize, and then we're getting glyphosate, which is a broad spectrum antibiotic. You're going to tell me that's not on the corn anymore and like all this rigmarole. Well, then why are we seeing chronic illness at epidemic rates that we've never seen before?
Yeah.
Like this is not, we kids, I think it's like 1 in 4 kids has asthma now. Like that's insane. That should not be the case.
Yeah.
Kids should, and what was that statistic that came from the CDC a couple years ago, maybe in 2018, 2019, like over 200 chemicals in the placenta of a newborn baby.
Yeah, that's wild.
And including things like DDT, which we don't even use anymore. So that's why, like, thinking about generationally, like, we're great-great-grandparents of that little kid that I saw with head-to-toe eczema running around in the DDT truck spray in the summer, which a lot of kids did. Because that was fine, right? It was fine until it wasn't. Yeah. That's one of the struggles I have with American standards is like it's generally regarded as safe or grass until proven otherwise, versus in other countries it's generally regarded as not safe until proven.
Yeah.
So we have a little bit of a double standard there.
Yeah.
Better for profitability of businesses, really not good for the long-term consequences of our health.
Yeah, and how do we expect parents that are, working multiple jobs, have multiple kids to be able to have the bandwidth to be like, taking foods away from their kids, if they're lucky enough to have them eat. And, so it's a very tricky situation. But I think it starts with the parents.
It really does.
And even just eating at home more frequently rather than eating out. Putting some greens in your fridge, adding protein. You don't necessarily need to take away the grains. Starting with adding is probably the best place to, and you mentioned like having protein before you have your carbohydrate yesterday.
Yeah.
So
made a big difference in one of my patients' blood sugar.
Yeah.
He was not willing to change his diet at all. And so I took a page out of one of our teachers' books of like, okay, well then work with the patient where they're at. Great, you're going to eat your McDonald's and you're going to get a a half-pound burger, and you're going to eat that meat patty first before the rest. I couldn't even get him to eat vegetables, which is fine. But that alone dropped his A1C by 1.9 points in the course of a year. And he was on 3 medications. It was a struggle bus.
Yeah.
And so just that one thing made that big of a dent.
Yeah. Yeah, and it's so interesting because everybody's so different, because I have patients that are doing everything right dietarily.
Yeah.
They eat better than me sometimes, and I don't eat that great sometimes either.
80-20 is the rule I go by.
It's about balance, yeah.
Yeah.
But it's just that's where it's just so like what we do is really fascinating. You have to really do investigative work to get to the bottom of those things. But in terms of like generally speaking, how we can improve, the public health of families and kids, and preventing some of these chronic, inflammatory conditions, autoimmune conditions, gut conditions, some of the big allergens, wheat, dairy, those two alone do a lot of trouble for families and kids.
They sure do.
And I was going to mention that, I see kids that I just dove back into the standards of care like a month ago, and I realized that there's a whole industry revolved around taking out kids' tonsils.
Yeah.
And how quick there's one treatment before they decide to do a tonsillectomy on kids. Instead of actually figuring out, maybe this kid's drinking way too much dairy, and which is, it creates mucus. It can cause a little bit of inflammation in the nasopharynx. Maybe
they have reflux and they don't know because no one's asking the right questions as far as silent reflux goes, which is definitely something I've seen.
Right. And then, and that might be going on. A little bit of sleep apnea, a little bit of maybe some vitamin D deficiency, maybe just some general lack of nutrients in their diet. And like you said, talking about taking pets away is a really hard conversation.
It's horrid. I hate doing it.
But I've had to do that. You know, it's and I don't even know if that happened or not, but it's like there's an elephant in the room. Like,
at the very least, put an air purifier in the kids' room, and like if the only thing you can afford is the $20 one at Walmart, great. That's where we're going to start.
Yeah.
No pets allowed in the kids' bedroom. Wash the bed sheets once a week. Like, there's a lot of things we can do before taking the pet away. But man, pets in the bed, as someone that used to have skin problems, no pets in the bed. Sorry, bro.
Yeah. And
it's a rule.
In herbal medicine, there's a whole category of herbs called lymphagogues, and your tonsils are the first, barrier to entry of your immune system to the outside world.
Yeah.
And lymphagogues help move the lymph, move those immune cells or potential, bacteria and things out of there.
Yeah. What are some, when you've worked with kids, because I don't really think I've seen any adults with enlarged tonsils. What are some of the lymphagogues you like to use with kiddos?
I do use a little low dose herbs, but we have a medley. It's called Lymph Mover.
Cool.
There's literally like a little medley of lymphagogues in there.
Cool.
Red root.
I love red root. Yeah. Red root and poke. Okay, that makes sense.
Yeah.
Maybe something to make it taste a little good, because kids are I can get my adult patients to take some nasty tinctures, but
it would be nice to make our own and add some glycerin to it to make it a little bit sweeter, but just having someone dilute it and
throw in a little water.
Yeah.
Have parents
just
that
a
mix
little
it in
bit of juice.
Exactly. Helps to kind of cover it up. I have some kiddos that love taking their tincture. It's kind of cool.
Yeah.
I'm a big fan of getting kids started early with herbs. So here's one thing that I hear all the time. Well, why would I use herbs that are antimicrobial versus an antibiotic?
Yeah.
The reason that I like to use herbs first, if we can, and there's a time and a place for antibiotics. One of the greatest modern inventions in my mind is antibiotics. We save people's lives every day. Thank God. Mm-hmm. But we also abuse the digestive tract. We kill off the microbes. What's really cool is there's data that shows that herbs are selective in their killing capacity. So if you have a pathogenic bad guy E. coli that's causing you food poisoning, and you do herbal medicine to kind of take care of that, it will go after the pathogenic, the bad guys, and leave the good guys alone. We have evolved with herbal medicine since the beginning of humanity. And that in and of itself is so fascinating that, conventional antibiotics, well, they have a place. If you've got sepsis, you got a kidney infection, I think antibiotics is a great place to go.
Yeah.
But if you got food poisoning, do you really need to do an anti-diarrheal, an antiemetic, and take an antibiotic? You just got rid of all the ways the body takes out the trash.
Yeah,
I'm sorry, no one likes to have diarrhea, but
right, yeah. I mean, and those are the tools we have here in Colorado. Right. So we're definitely specialized in using antimicrobial herbs. Even berberine. It's like, oh my God, I can use berberine for so many different things.
Yeah.
And
berberine is a constituent,
right?
As opposed to whole plants. So things like Oregon grape and golden seal are plants that constituent comes from. Yep. I'm not a big constituent person. I like to use whole herbs, but just so people know what we're talking about.
Yeah, it's like curcumin is to turmeric. Berberine is to hydrastis or Oregon grapefruit.
Yep. Herb. That's what I love about herbs is they never do just one thing. Like, I did a treatment with a guy. I didn't even know that this person was having some prostate issues, and I, give this shtick like, okay, what we're doing with herbs is I'm using this formula for this specific thing, but there might be some other effects that it has. Usually good.
Yeah.
And he was like, by the way, my urine stream has improved. And I'm like, oh, damn, fantastic.
Yeah.
And long term doesn't need to be on something long term. Like, he wasn't seeing me for prostate issues. We were working on something else.
Yeah.
And that's what I love is medications, pills, they generally do a whack-a-mole.
Yeah.
You're having reflux, we're going to give you a PPI, you don't have reflux anymore. Or so they think. But then you develop Barrett's, and, that's a whole nother conversation. But one thing, whack-a-mole. You take your hormone birth control, whack-a-mole, and something else comes up.
Yep. Yeah, you get into the realm of side effects, and you're going to be busy forever, and that's the model that we're trying to help out with. And that's with antibiotic regimens. That's where I get hung up is all you need to do, and more people are starting to do this. Take a probiotic while you're taking your antibiotic, and then go see another doctor, see what might be going on.
Yeah.
And so it's never really like that easy. A lot of people do get away with it, and that's great. But a lot of people.
My question is do they actually get away with it?
No.
So I just gave a talk at one of the local offices in town, kind of like, sharing what I do. And one of the questions from the audience, because we were talking about hormone health, sex hormone health, was what can I do right now to help my hormones? And I said anything with fragrances, perfumes, colognes, perfume, trash. And like, jaws dropped in the audience. It's everybody was a lady that was working there, and they're like, yeah, but that's only for some people, right? And I'm like, no, for everyone. It's literally toxic. There's xenoestrogens. The fragrance industry is like 4,000 plus. They don't have to tell you what's in their fragrance. Yeah. It's just fragrance done.
Yeah.
And, I was talking about infertility and that type of a hormonal issue.
Yeah.
But the reality is, even if you yourself are not having problems from your fragrance candles, maybe your kids are. Maybe you're trying to get pregnant next year and you got pregnant, no problem, but maybe now your kids might have some reproductive issues or some sex hormone struggles as they start going through puberty. Yeah. And it could very well be because we have perfumed ourselves to death.
Yeah.
I hate to be that person in the environmental medicine, we can go really down Debbie Downer down that path. But the body is so freaking capable.
Yeah.
That's what I love about it.
Yeah. Yeah, personally, it's hard for me. Like, okay, so I come from a big family, and everybody's on a different page when it comes to their ability to, take care of their kids and what they want to do. But it's the simple things that are the most easy to talk about and address. Like, okay, like screen time, sleep, blood sugar. Those are things that you're already going to be working on. Worrying about all these other like chemicals in their environment is way over people's head
for a lot of people
most of the time.
Yeah.
Even like we were talking about sunscreens yesterday, and like, there's like, okay, what are the big things that we can knock out?
Blood sugar,
the foundations of health.
Yeah.
Hydrating. Not eating excess sugar. And
getting in sleep, moving your body.
Stress management is a big thing. I think a lot of people are overworked, underpaid. I was going to talk about the income to housing price gap and like how the ratio's drastically increased since 1985, like almost doubled or tripled.
It's like I thought
the ratio,
so it did like 5 times. It's like your income now is like, I'm not going to remember all the finances, but it made me feel better as a millennial because it's like, my rent in my undergrad town was like an expensive rent was like $400, $450.
Yeah.
Like, and now pretty standard of like $1,600 for a room.
Yeah.
Whether that's including utilities, I'm not sure.
Yeah.
But that's disturbing to my soul when like we get called lazy by our older counterparts, and we see this, and maybe this is part of the issue with Gen Z. And who's after Gen Z? The generation that's about to be.
No, not Gen X.
Alpha generation. Yeah. These guys are going to have a little bit of a different struggle, and like we have to think a little bit outside the 9 to 5. The 9 to 5 thing, it doesn't work anymore. It doesn't make money. You're going to tell me working for $13 an hour is going to pay my bills and take care of me?
Yeah.
Not with the cost of all this stuff. No, thank you. And this is part of health. This is part of our financial health.
How are you supposed to take care of yourself if you're spending that much time away from what matters to you? And
working a monotonous job that you don't like with a shitty boss.
Yeah, that's another huge thing. There's and with networking, I've seen more and more of like what kind of jobs people are working, and the people I see they like their work. They're out there like they're networking and chatting up their business, but like so many people, just are struggling with, they might have to work multiple jobs or working like 12 to 16-hour days is insane. Like postal men and postal women. Yeah. It's just like, how do you have time to take care of yourself or think straight, or even, by that point you're coping with just trying to like take the edge off.
Yeah. I'm going to have my vape. I'm going to have my 6-pack.
Yeah.
I'm going to take my benzos, whatever it is. And it's like, not to blame. It's like, this is the reality that we've found ourselves in because the world is tough.
Yeah.
You know, a common diagnosis in our profession is adrenal fatigue.
Yeah.
I don't love that diagnosis for a number of reasons, but that's not the point. One of the functional testing I run in office is called the blood Bullen analysis. It's just dried blood under the microscope. We just look at it. And I see my youngest patient that I've seen pretty significant quote unquote adrenal fatigue in, 6 years old. You're going to tell me that kid that's barely out of the womb has such severe adrenal fatigue that it's showing up on his dried blood sample? That's insane to me.
Yeah. What does that look like?
It looks like pinholes in the blood sample.
Interesting.
Maybe if we come to the office, I can do one for
Yeah.
you. But my question is, are we then treating the adrenal fatigue, the adrenal dysfunction, which conventional medicine doesn't exist? It's either Addison's or Cushing's. There's nothing in between, which we do a lot of in between things. And while I don't hang my hat on that diagnosis and I don't love that diagnosis, that speaks to what we're talking about, the housing, the financial, the stressors that this 6-year-old doesn't even know about.
Yeah.
But feels like there's I need to get into like some fancy preschool and I need to be doing this and like, can we just be a kid?
Yeah, and the kids' ability to regulate their nervous systems is being impeded as well.
Yeah.
You know, when they're handed an iPhone or an iPad, and or maybe they, you know, we could get into birthing and all of that, and you know how there are more and more obstacles or, you know, issues with mothers and infants not bonding properly.
Yeah.
And so there are a lot of things that are really important for, like a lot of people have dogs. I could relate this to my dog. You know, I raised him a very specific way. I socialized him. He needs, you know, to be kind of stressed in a healthy way.
Right.
They need healthy stress. They need, you know, real life events to train their nervous systems of how to de-escalate, how to calm down, how to release GABA, you know, calming neurotransmitters that are going to help them, you know, live in a world that is becoming more and more stressful and chaotic. And so,
and this is not to blame the parents either, because like I was raised by a single parent, and like I don't know how my mom did it. She worked graveyard shifts. It's social norms, exactly. It's normal for a 2-year-old kid to know how to use a computer better than I do. Yeah. And I had my first computer when I was 9, but I also played outside until I came home with like scrapes and bumps and bruises on myself and dirt on my face, like. Kids, well, now we live in a slightly different world too, because now we're talking about like kidnapping and like
Yeah, well, and
these risks.
People can't afford to send their kids to daycare and all kinds of stuff where they would be socializing and you know, being exposed to germs and strengthening their immune systems and challenging their immune systems and nervous systems.
Healthy stress.
Yeah.
Right. Yeah, and we get into all these complexities, and you know, as a person that's going to be postpartum soon, I know that postpartum care is pretty abysmal in this country. The way we take care of our new moms, whether they're new first kid or, you know, this is their 5th kid that they've had, postpartum depression gets missed. Here's your antidepressant, on your way.
Yeah.
What is postpartum depression?
Well, and you have that initial checkup, like right when you're in the hospital, which is typically, and we can get into, because I have the program, I don't know if I'll do, you know, my 12-week program, online program for postpartum depression and anxiety. But essentially, you know, you have that initial hospital experience, and then you have the 6-week checkup. And somewhere in there, if you're concerned about your mood, which is scary to admit to a doctor, you know, you're given the Edinburgh postnatal depression scale. It's a questionnaire, and that confirms your diagnosis. And rates of postpartum depression are like 20% right now, and that's just what's recorded. Yeah. And anxiety is even higher, and that's not even mentioning the other more severe things like psychosis. But a lot of times it gets, you know, maybe you have baby blues, which is like the first 14 days. And so they kind of rule that out if you're getting better at that point. But yeah, I could talk about my program.
Let's talk about it.
So it's more of a passion project. It's not necessarily something I'm highly specialized in. It's something that I started researching and putting together on the side. And the reason why is because I see that aspect of public health and family medicine as the most crucial, existentially speaking, to address. And more mothers are finding there are a lot more obstacles to showing up the way that they want to show up.
Yeah.
Via, maybe a traumatic birth experience or C-section. You have different things that can happen during childbirth that kind of impede that mother-infant bonding. And I talked about how important that is for the nervous system regulation.
Right.
But there's also research pointing to a drastic increase in IQ points with that and breastfeeding. So.
And attachment styles, I know, are kind of developed in those first few months too. And in an ideal world, I'd love for everybody to have a secure attachment to their parents and feel safe so that they can go and explore and like have that nervous system regulation.
Yeah.
But so many parents have to go back to work pretty quick, and the United States has terrible maternity leave and all this stuff. And that's if they can't even afford to go back to work because cost of childcare is a big problem in this country. It's like 73% of a woman's income, if they make like a $65,000 job or something, goes to childcare. Yeah, and that's one kid.
It's unpaid maternity leave. Yeah. Maybe you get 14 to 21 days paid for, but it's up to 12 weeks of maternity leave. And in places like, I was comparing it to like Sweden, where they get like 480 days of maternity and paternity leave that's paid.
Yeah.
I don't know if we can compare it to that, but mothers have to go back to work, so oftentimes they don't spend the full 12 weeks. But those are crucial times that literally set that 1 degree difference in the trajectory of their child's development and their IQ levels and their ability to, not fall into things like addiction. And I'm not saying that it's going to solve that issue completely, but it is a huge step in being able to live a healthier life and be emotionally regulated, so they can take on challenges that are inevitably being passed on to them.
Yeah, you're thinking the future, like how do we help the future generation?
It's preventative medicine.
Exactly.
Which
is way easier than trying to reverse type 2 diabetes, I'll tell you what.
Yeah.
Easier in the sense of it's less work, but it's still work.
Yeah.
And so again, we're being mindful to not be blaming, because we understand that the society is set up in a way that is non-functional.
Yeah.
And the reality is better outcomes when kiddos are able to be with their mom for a minimum of 12 weeks.
Yeah, the physical contact is huge.
Yeah.
And just speaking from being in a family of 4, it's like, I actually have a unique experience where when I was born, my entire family went to the circus for some reason, and I never really got the full story as to why. But my dad took my 2 older siblings to the circus. Okay. So I got all that time with my mom. Cool. And both my older brother and sister were C-sections. And my mom hired a doula with me, and I think she had a midwife too. So she did everything very differently with me, and had a miscarriage before me as well. So a lot of things, that moms are going through. Yeah. And I have pictures of my mom holding me in the hospital, and I'm like, that is a huge reason why I feel like it played a big role in my life. Yeah. There are a lot of things down the line that were huge challenges and obstacles, as we all have. But I also was blessed with a lot of things, where I was born, and my dad being a dentist, right? But losing him at an early age, a lot of things. But just thinking back to how important my mom was for me and still is. Those are the times that are most important for setting your kid up for success, and setting yourself up it's the most essentially what the program does is it teaches you all the modalities that I practice in medicine. Yeah. So how do you, simple things like how do you get your hormones in balance? How do you check those? What are the different providers that might be useful in looking into? Different resources, And I mentioned doula care, and there's a lot of data on how doula care really does improve outcomes before or during the birthing process and after. And then, I go into like environmental medicine, kind of relational aspects, communication, purpose in life. I think a lot of the other issues that we're seeing on a larger scale are going back to the 9 to 5 and jobs that we don't like, is not really feeling like we have a purpose or direction.
Yeah.
And a lot of times what we're doing feels overwhelming in their purpose and direction, but I couldn't imagine, not having something that really pulls me out of bed and excites me.
Yeah.
And our day-to-day life of being able to manage our own health, like not working a 9 to 5 job, but still, doing research and like prepping for patients and doing all that. It's constantly learning, and it keeps us on our toes, and really is exciting work. And I just brought that to my program, and so I'm hoping that it's financially a smarter choice than some of the other things you might run into, like the novel medications that are focused around kind of using the analogs of allopregnanolone, which it stimulates GABA receptors, which is the main target of therapy. But that medication costs like almost $15,000 before insurance.
Oh my God.
But less than 1% of insurance companies cover that medication.
Oh my God.
Your only other option is SSRIs, and there are only a couple that have lower rates of
problems,
trace levels in the breast milk, and so on.
Yeah, medications. It's just like, see, it sounds like a good idea. They dress it up as this whole thing. And I remember when that one, the allopregnanolone, and pregnenolone is the precursor in like the cholesterol synthesis pathway, being a concern with, it's similar, benzodiazepines, things like Valium and Xanax, they operate on a GABA receptor as well. And so like the concern is this going to become a long-term addictive component, which you're already in a vulnerable state, being a new parent. It just like, all these things that like, I don't want our moms to be taken advantage of.
Right.
But also they don't feel supported. And like one of the things I remember in school learning about was B vitamin deficiencies are super common with postpartum depression.
Yeah.
And like, why isn't that something that's discussed? Is this person eating liver or any kind of like organ meat where they can get those good B vitamins? No, nutritional yeast is not a good source of B vitamins. Sorry. It's analogs that our body doesn't really know what to do. So supplementation is necessary if you're going to have a vegetarian or vegan diet.
Yeah.
So I'm not against those things. We just have to understand that the nutritional information we're not getting those pieces.
Yeah.
Like we start with simple things before we go to these really high force interventions, and it can be profound.
And there's a lot you can do with diet too.
Yeah.
How do you support GABA with diet?
Right.
Specific amino acids that are rich in certain foods, glutamine, there's all kinds of. We talked about inflammation, addressing inflammation, addressing sleep issues, addressing stress, all those things.
Yeah.
And the B vitamins, B6 is a huge nutrient for converting neurotransmitters and making melatonin, all these anti-inflammatory compounds. So we're coming to the end of our time here, and we've talked about a lot of different things, but we made sure to take into consideration like the bigger picture and not point fingers, and it's complex and nuanced. And I guess the question I have is, how frequently do medical doctors think about this complexity and this nuance in their 12 to 15 minute visits, and take these things into consideration? So briefly, what we talked about is things we see in practice that are kind of disturbing, things like vaping, the psychiatric industry, the psychopharmacologists. I'm just going to, leave it there. We talked about hormone health and specifically what exactly that means and some of the testing that we like to do. We talked about leaky gut, aka intestinal permeability. We talked about antimicrobial herbs and why it would be beneficial to use those over just plain pharmaceutical antimicrobials. But there is a place for both. Foundations for health are great basic places to start with. We talked about some cases of like, caffeine withdrawals, or like you're drinking a bunch of water before bed, and like we work these up for severe pathologies. But
actually they were really simple things. We talked about housing and financial health, and this has become a social norm of like you have to work multiple jobs, and you know, we're not necessarily being lazy, but the reality is like $20 doesn't go as far as $20 did in the 90s. It just doesn't.
Yeah.
And then we ended on postpartum depression and how that's really important that we consider as a public health urgency, crisis, emergency. Like we're trying to think about like moms and then our future generation, and like they are the foundation of our society. And if we don't have them in a good place, we're kind of screwed.
Yeah.
In a way. So things that are easy for you guys to do at home, if you can't afford to come see us naturopathic doctors, as much as we would love for you to be able to, our job is to teach you things so that you don't need us. And my job is to run myself out of a job. And I will never be out of a job because there's no shortage of sick people, unfortunately. Things like eating at home. While it may take a little more time if you think about it, especially if you go sit in a fast food line that has 8 to 12 cars deep, which I often see at the Culver's and McDonald's here in town. Mm-hmm. You just spent 30 minutes sitting in line when you could, have thrown something together pretty quickly. And it doesn't have to be complicated. Ground beef, onion, carrot, salad, done. And some spices, done. Like 30 minutes if you get quick at it. Add some greens, add some proteins. We don't have to take away things. You can have your ultra processed mac and cheese, but throw some hamburger in it and like throw some collard greens in it. Done. Now you have a complete meal that's balanced with carbs, protein, and vegetables. And then I'll just throw this in there just because you can reduce your fragrances by stop buying those products. Like some simple things. Save yourself a little money. Save yourself a little hormone dysfunction. Anything else you'd like to add, Danny?
Yeah, just the rest of the foundations of health.
Yeah.
You know, I mean, take time. I mean, community is another big topic that I wanted to talk about. But more and more people are, I've lived in Seattle, I've lived in Fort Collins, and, the cultural difference is huge. But just seeing how important it is to say hi to someone you see walking down the street.
Just acknowledging a human.
Acknowledging human, bringing community back to your consciousness, like engaging people in conversation. It helps you regulate your nervous system, and so much of what people are struggling with right now that's feeding the stress is loneliness.
Definitely.
And
it's worse than smoking cigs, if I'm remembering correctly, as far as health outcomes go.
Yep.
Where can people find you if they want to get in touch with you?
Yeah, I think the best place to find me is my Instagram. It's Dr. Dandelion _92. I have all my links in there for my program. I have my clinic website. You can find me if you Google me, Dr. Danny Dowling, ND, and then the program is Healing with PPD and PPA, and it's on Kajabi, which is a platform. So if you want the link for that, you'd have to go to my Instagram and find that.
Very good.
Yeah.
And I really appreciate you guys tuning in today. If you found this conversation to be valuable or controversial or anything, send it to someone, share it with someone, like and subscribe. It's really helpful for me. It's a free way to support my channel and let me know that you guys are interested in the information that we're providing here on this show. And our next guest, I'm not sure, I'm not remembering who it will be. I actually think it's going to be a doula. Interestingly enough.
Oh, good segue.
Yeah, good segue. So thank you guys so much for tuning in. Dr. Shayna Powell, have a great rest of your day.